So this is great for the people that are joining us online. They get special treatment today. But I want to start off the webinar by, of course, introducing my special friend, Dr. Arpit Bansal, who is very well respected cancer surgeon in India, but also worldwide as a wellness and longevity expert. And we've been on many trips together, and I'm always very awed by your presentation, and you talk a lot about blue mind and red mind, and I think we want to get into that a bit because it's a very interesting concept, and it goes a lot with your interest in water and how water relates to biology, which ties in so nicely with, of course, my interest in light, because water and light are kind of two sides of a coin. And of course, we're very, very and we're very, very honored at CeraThrive that you're going to be joining us as our Chief Medical Officer. So that's big news for us, and this is a really good way to introduce you to everybody as part of that team. So we've got a few questions that we're going to go through. We've got a few topics, but maybe Arpit, you just want to talk a little bit about kind of your interest and kind of why you're interested to come on board and your interest in photobiomodulation.
Hi everyone, I am Dr. Arpit Bansal, and thank you, Sarah, for such a kind introduction. And with Sarah, it's been a special connect last 2025. I think as she said, we met at multiple places. And I am a cancer surgeon by profession. I'm also a gut specialist, and I'm into this longevity since many years now. And I have lots of clients. So as a gut specialist, people walking into my clinic, I used to there were lots of young patients these days coming to me with piles and gut issues. And most of them, when I deep dive, they have some anxiety issues and some basically their minds. Most patients walking in my chamber is in their red mind. We will talk in depth about it. And then if I heal them with the right molecules or the right surgery also, but I don't work on their mind and bring their red mind to the blue mind, then I'm not creating true healing. And that's where my journey of water began, where I started diving deep into what true healing means. And now I'm working on resilience, because water is the most resilient anyways. So from there, my connection to Aquaman, being the Aquaman biohacker, being working on your HRV, and then obviously your heart rate variability is what measures your resilience. And your resilience is basically how well you balance your blue mind and the red mind. And now being a gut specialist with this knowledge, now it connected to my being the guts action. And then obviously we talk about the gut brain, and it's a curious aspect which where we are again going to dive today. So from one thing, curiosity led to another, and now basically the gut brain connection is where the magic lies, and where we have the photobiomodulation. No, so people know that there are so many red light therapy devices these days, but CeraThrive, apart from the special connection with Sarah, of course, I'm joining, and I'm honored to be joining as the Chief Medical Officer, because it's a unique out of the box thinking, but in alignment with nature, in alignment with the photobiomodulation. We basically simultaneous use of photobiomodulation on the brain and the gut area, through molecular biology triggers the gut brain connection, and that's where we're going to dive in today.
Yeah, so, brilliant. Thank you.
I want to now do some science-backed research so that we can slowly bring it to the medical grade community also.
Yes, for sure. That's where we're going next. And I think we can talk a little bit about research and what's happening. But maybe this concept of gut brain is very interesting. And for a lot of people, it's a new concept. What is your current understanding of the importance of how the gut and brain are connected?
In life, anyways, everything is connected, and gut and brain are connected in a much deeper way. Obviously through the vagal nerve, that's the main physical connection, if you would say, to the gut and the brain. But apart from that, even through microbiome, and even through molecular metabolites, even through the molecular mechanism, your serotonin in your brain and your serotonin in your gut are directly neurochemically connected. And they are transmitted, of course, through the vagal pathway, and even cytokines and immunomodulatory pathways also. So gut-brain connection is real, and I see it clinically every day in my practice, because most patients with either the anxiety issue or the gut issue, if you deep dive into their sleep, their circadian, their gut, their hydration, and then everything, you can understand the patient so much deeply.
Yeah, I wondered about that because, like you say, you're mainly a gut expert, but how often do you see that connected then to some kind of brain fog
Every
or
time,
brain
like
issue?
I think
Every
almost
time.
99% time, like if I see, not every patient is ready to be me, allow me to deep dive into both the aspects. So whosoever is open, I ask the right questions, and I'm 99% it's connected.
And I think one of the questions that people ask about CeraThrive is how is targeting the gut brain connection simultaneously with something like light? How does that work biologically in the body? Because I think people, first of all, they need to understand this concept of light therapy, because for some people it's a bit of a leap. And then they need to understand why would you target two organs at once? So from your research, what's kind of your response? I know that you also include red light therapy as one of your topics. So maybe you
Mm.
can kind of a little bit go into the biology of that.
See, biology definitely never treats the gut and the brain as separate. It's definitely a one regulatory circuit. And like
Yes.
gut-brain connection, obviously we've been talking, it happens through neural, the vagal pathway, then the immune, the cytokinins, even the endocrine is also connected through circadian, then microbial metabolites, as we spoke about. So this explains like why gut disinfection also, like dysfunction also shows like as brain fog we were talking about, right?
Mhm.
So now first of all, we need to make things people clear that photobiomodulation is not a treatment. It's like a biological signal which we are giving. So it's like an input signal which we are giving. And
Yeah.
then so basically it works on three models, I believe, and on mitochondrial signaling through the
Yeah.
infrared and the near infrared light. It interacts with the cellular signaling pathways. And then we also often discussed with in terms of like mitochondrial redox balance and energy signaling. So this is how the photobiomodulation, the red light works on the mitochondrial signaling part of it. Then it also works on the nitric oxide and the blood flow and the inflammation modulation. So like literature obviously speaks that photobiomodulation, it stimulates the nitric oxide signaling and inflammatory modulatory pathways. And
Yeah.
then obviously at the network level, obviously the cellular shift which can be scaled, like all these changes can be scaled to a systemic level when multiple systems get involved. Then even pain perception, sleep. So it works on multiple dimensions at the same time. And like so, but people need to understand that photo biomodulation or red light is not magic. It's like important, and with anything is dosage and
Yep.
consistency, and then the
Yep.
right target also matters. So like uh, we know this gut brain connection, and there definitely exists a nerve. And again, people get this wrong that vagal nerve is a unidirectional pathway. It's a bi-directional pathway.
Yes.
So,
Yeah.
like, and if you stimulate both the ends together, then definitely there it makes sense to it, and scientifically it's been now justified.
Yeah, for sure. So we talked a little bit about research, and we're hoping to start some research in your hospital. What do you think are the conditions that you would start with that would respond perhaps the quickest to this kind of targeted therapy? I know we're probably going to say, almost all conditions because we're talking mitochondrial level, but what would be the most interesting thing for research?
I think IBS,
Yes, yeah, I was going to
I,
say that too. Has a
because
strong
like,
component with the gut and the brain.
it's a strong component, and again it works on the neuromodulatory pathway. It's like also on the immunomodulatory pathway. And with drugs there has to be so many angles. So like if photobiomodulation can take care of the little bit of the microbial the molecular structure helping behind it, then obviously we can regulate it through medicine. So like again, people need to be clear that this is not a replacement for treatment. This is a good adjuvant. And for most of the claims, like whichever things we are, it's not a replacement, but obviously it is a great super adjuvant. So
Yes, for sure.
also we were talking about like the dual side photomodulation. So it may also influence regulation more efficiently than single site approach. Like if you give like at one place and then if you do it both places, then so we'll have to do. And like there is also growing discussion about the photobiomics, how the microbiome will also change inside our gut, and then definitely that will impact on the other parts. And then even there is emerging like other journals I keep reading. So they say that brain gut photomodulation can even be helpful in stress related conditions.
Yes. Yes, of course. And how much do you think that stress plays into these gut issues, Arpit? Because I'm sure you.
Like it's like I'm like like I'm in shock actually when like many young patients see IBS is a disease like old age usually tend earlier needed to get earlier, but now with the junk, with their circadian biology mess up, with the overall mess up of the young people, and then obviously their chronic red mind being on all the time, it's like more common that the younger patients are getting in, and that's where I want like to try even much more multi-dimensional approach and include more of these red light, because there is no point giving the younger generation more drugs and like more pharma based drugs they can because I'm shocked like 20-30 years old people who like obviously suffering from IBS and anxiety, they go to psychiatrists and they give them like anti-anxiety pills. Like imagine if young minds at 20 and 30 are going to get those pills, then they become zombies ever after. How will they unlock their true potential? And like coming
Yeah.
back to gut brain, like gut brain, I would say is definitely not a metaphor. It's like it's electrical connection, it's the immune connection, and it's obviously the metabolic circuit going along with it. And the more important thing is how it regulates the autonomic nervous system tone, and it brings us more to the common calm, relaxed, blue mind. And that's the master regulator of digestion, of mood, of sleep, of everything, I think.
Yeah, let's talk a little bit about your concept of blue mind and red mind, because it's a really nice concept for people to grasp. Because I think people understand, when you get stressed, that it can kind of cause illness, but I don't think people really understand the implications of like long-term chronic stress on their health. And I know that you put it in this lovely poetic way, so maybe you can explain that a little bit more.
So, like, see, for all the listeners who are like curious till now, what we have been speaking about the blue mind and the red mind.
Yes.
So, like, as we all know, our nervous system, apart from our voluntary nervous system, like if I close my wrist and if I open my wrist at my will, then this is my voluntary. I'm just commanding it directly. There, thus, other main nervous system is the autonomic nervous system, the subconscious nervous system, which you can say. And in that, there are definitely the sympathetic, people call it the fight and the flight response, the
Yeah.
sympathetic nervous system, and the uh, parasympathetic nervous system, the rest and the digest. These are the classical terminologies which have been started since the beginning. But like, so it makes us think that red mind, or sorry, the parasympathetic system is the flight and the fight. So, for example, like if you are in jungle, if you are and like a tiger comes next to us, and like we spot a tiger, and like so we will definitely not sit in a Buddha posture and meditate next to the tiger. We'll our alert mode will get on. Like a more practical in example, like if you're sleeping in your apartment in maybe any metro, and hear a bomb blast in your building in the middle of the night, or maybe at 2 in the night, you will get alarmed, and you will suddenly trick out, like even in your deep sleep you'll get up and your sympathetic drive mode will be fully on, you will be on fire, and you will do whatever you need to do to protect yourself and your loved ones. So that is the red mind. Red mind is not the bad mind. The sympathetic mind is the fight and the flight. So for example, when we were hunter gatherers, I like to connect always to the hunter gatherers approach, because that's what nature made us initially. So when
Yes.
we were that, then we needed these kind of drives to catch enemies, to kill animals, to eat, etc., etc. But when we and like the blue mind is the calm or the parasympathetic system will like which makes your heart rate down. So for example, any doing things like if I love running. Now here I will first let me clear the concept, and then I'll talk about mixture of both. So for sympathetic is the red mind and parasympathetic is the blue mind. Sympathetic is anything which makes your heart rate go high,
Mhm.
and parasympathetic or the calming down is your anything which brings your heart rate down. So blue mind is calming yourself down, and the what's the best way to calm your mind is breathing. Like we everybody in all kinds of meditation, the simple thing any kind of meditation or any spiritual activity, the single thing we ask people is to be in the now and breathe. And it automatically brings our heart rate down. That's the calm or the blue mind. But now we say that uh, blue mind is actually defined as a state of well-being, calm feeling, just happiness in the now. Like, and it we all humans reflexly achieve that when we are near water, around water, over water, or just seeing a water scenery, or even just hearing some sounds of water, because we are all water babies. Because first 9 months of our lives, we were underwater in our mother's womb, and
Mm-hmm.
there was no exception to that. So that connection to water is always there. And there's no coincidence. Then you go to a Central Park, New York, or London, any park, and you will see the most people near the lake, because that
Yeah.
water body has some sense of calmness, and to nature and to us both. So people are drawn towards water, and the water has this property because, again, our bodies are also 70% water. Planet Earth is also 70% water. So again, this connection also says that we are connected to water in much deeper ways than we really are in our materialistic, realistic world. So
Yeah.
basically, we should activate. We should, and like, for in terms of longevity, how does it matter? In terms of today's life, how does it matter? Because most people, so in general, we proved that the red mind is not bad. Red mind is needed to do things. If I want to go for my run, I need to be in my red mind. If I want to do surgery, I want to be in my red mind. If I want to do any task, to do any things, you have to be in your red mind to activate those things. But blue mind is the calm mind, coherent mind, where you are just connected and being in the moment, being in the now, and just being. So, as we discussed, that with water, which is obviously abundantly possible automatically. And the balance between this blue mind and the red mind is the key, is where we life happens. Because in day-to-day life, stresses definitely happen. But the main issue is most of our current generation is living in the chronic red mind, and most of our diseases, be it cancer.
Mhm.
Sorry about that, there was a call. Yeah.
Yeah.
So yeah, be it cancer, or be it inflammation, be it any kinds of disease, it is the root cause is inflammation. And
Maybe what people also don't understand, Arpit, is when you're in that chronic inflammation, that's when you actually damage your gut. That's when the damage actually occurs. You
sorry,
know,
sorry.
people.
Sorry for the disturbance. Yeah. So when we get up, a normal person, ideally, when now connecting this to the brain waves, when you go to sleep, obviously, the active type is the beta waves, and then when we go to sleep, we pass through that magical alpha state window where you're half sleep, half awake, and then when you go to sleep, your waves go more slower, theta and delta. So from a higher, faster beta, you slowly transit through alpha during your waking up period and sleeping down period, and then you in deep sleep you go to theta. So and the next day when you get up, most people get up with alarm clocks, with notifications. The moment they get up, they switch their minds into their task based network and not
Yes.
their default mode network. So these are like some concepts which are deep concepts, but if you want to really understand it, then people need to understand what the difference. So there are two things: the blue mind and the red mind. And then we need to be less in our chronic red mind. So most
Yes.
people are living like, from the moments they get up, through an alarm clock, they're ping ping ping, constant notifications on their phone, and they're constantly running after things. I have to do this, do. And even think people who are just lazing around in home, they are still in their mind, they are procrastinating and running about things. So that is the chronic. And then we are constantly on the edge. We have so much work pressure, we have so much financial pressure, and then we are eating wrong, and then we are sleeping wrong, we are not tuning ourselves to our circadian biology. So these all takes our, so basically longevity, in terms of longevity, true longevity happens, I would say. Obviously life is a balance between the parasympathetic and the sympathetic,
Yeah.
but true longevity happens in a more parasympathetic dominant state. and less in the sympathetic drive. So now coming back to a real life example, like for me, doing surgery is definitely I have to do. I told, and for going for a run, these two examples I'll take parallel. I need to be in my red mind to do the activity. But here is why where flow state comes into the picture. Like flow state is actually the right merger between your level of red mind or your level of doing things and your level of letting go. So
Yes.
and then that's the magical state where you can do perform effortlessly and still perform at your best.
Yes, and we're going to try and do some studies with that because, of course, with the CeraThrive headband, we can
Yeah,
modulate those brainwave frequencies to potentially get
exactly.
you into a different
Exactly,
flow
exactly.
state.
Yeah,
So
yeah,
we
that's
have
exactly
we have a 40 hertz, which is a gamma hertz pulsing rate.
right.
So that's
So
the
like
one way.
before
That's where
jumping on
you
this
want to
call,
focus.
here at my CeraThrive, and before jumping on this call, I was literally just doing that 40 waves,
Oh, you work
which you
great. Then you're focused.
yeah,
Yes. Yes, brilliant. Yeah, easy. Looks good on you up here.
yeah,
Looks
cool.
good on you. Okay, let's take some questions from the audience because this is really just a short introduction. I think what we're going to do is if anyone has any questions about any of these big topics, we can go over them a little bit more. And we're also going to do some blogs on the CeraThrive website. And of course, you and
So
I
all the
are
questions, yeah, definitely. So let me start with a few questions. Like I love the question; they are so in depth. One of the questions somebody asked was, "Is photo biomodulation safe for the brain?" Yeah, that's a definitely an important question. So
yes,
people need to understand that, and it's the most important question we need to sort it in the beginning. That photo biomodulation, it uses obviously non-ionizing red light and near infrared light, so it does not damage any tissue or DNA. That's the basic things. And obviously, it is generally well tolerated when used at the right dosing and the timing. Like you should not just turn it on and do it irrelevantly. That's why there are modes and suggestions, like usually 10-minute sessions. And like,
yes,
so obviously, if like what kind of side effects they can get? Some people, if they're overusing it or they have like history of migraine and stuff, they can get headaches, they can get agitated, and they may get sleep deprived or like sleep deprivation. Like that's the like a very extreme version of it. But otherwise, like just try to be more consistent and more like always do it under the guidance of a doctor if possible, to understand, and like we can do some online free simple do's and don'ts for people who
yes.
are like suffering from various diseases, because it depends. Like if a person with migraine, I'm not saying that migraine is a contraindication. It can actually help in migraine, but the dosing has to be right, and obviously it has to be started with a lesser intensity.
Yeah, it's for some of these things like migraine, because some people's migraine
And
is
like
set off with flashing
safety wise,
lights.
like I
Some,
should also say that in terms of we should avoid in patient with seizures and pregnancy and other kinds of
yes,
photosensitivity skin should obviously stay away from it, ideally, or
yes.
bring it gently.
Yeah, I think
So
there are certain contraindications, certainly pregnancy. Actually, cancer is a contraindication, but not because it's shown to have an adverse effect. It's just there isn't enough data to show that it doesn't.
I would
So
not
some
say
of the,
cancer as a contraindication. I would say like in cancer, it can, like if timed it rightly, and if like I think in cancer it could be an indication rather than a contraindication. We need to discuss that more.
yes, that's a doctor's prerogative for you to say that, Arpit. From our point of view at Sarah Thrive, we are on the side of caution. But of course, if you have medical supervision with a person like yourself, then some of these contraindications can be tackled on an individual basis, is what we
So
say.
like the other question, which was like, how does photobiomodulation actually work? We already explained that it's like a more of a biological signal, not a stimulant, and like interacts with the cellular signaling pathways, and like often the mitochondrial redox balance. And it can also improve microcirculation through activation of the nitric oxide pathways and reduce the inflammatory noise. And like it can, when like cells work more efficiently, obviously the basically it is helping you sleep better, it is helping you with your pain perception, and then in the long run consistent usage, even cognitive clarity can also improve.
Yeah, excellent. Yeah, of course. We've got a question here that's close to my own heart. That Bev says, Do you think that treating the gut brain helps with rosacea? This is an interesting because I had rosacea. You know, you have it where I had it across both of my cheeks, and I
Mhm.
had it for a very long time. And actually, obviously, I've been working on this company for like 3 years, and then before that, trying to test it out. And I have to say that it did disappear. And I think the cause of a lot of these skin conditions, and Arpit, you probably know better than I, is sometimes when you have like a leaky gut and you have a
Yes,
lot of metabolites and
that's
things leaking out, it shows on your skin.
absolutely, absolutely, and that is why like a skin. So there is a again, gut is a special connection. I think there is always the gut brain connection. Then there is a gut skin axis also. So that's how the like lots of you are absolutely right. Rosacea, even acne is also connected somewhere to your gut. So like Hippocrates, when he said that all diseases begins in the gut, he was
Yeah.
absolutely right at that time. And now we are like diving into the real science of it with especially with the discovery of the gut microbiome and all those tests. Now we can, like for example, diabetes, again, it's a root cause is hidden in like 5 to
Yes.
10 set of microbiome, like there is a set of obesity microbiome. So all these ultimately are definitely connected to the gut. And facial skin, though I'm not a skin expert, but it's definitely connected to the gut.
Yes, for sure. I think, you know, when people are thinking about these beauty treatments, you know, really you need to start from inside, you know, to really get the full benefit from
Like
from
people
the
say the right sentences, but they don't really go into the real depth meaning of it. People say the right sentences, yeah, you need
yes.
to heal or you need to be beautiful inside, but they don't scientifically, if you go to the deep part of it, you will get the connection.
Yes, for sure. Yes, as soon as you start to heal the gut, things happen, like you say, systemically. But the body is a whole system, so of course it's going to be the skin, the eyes, that like you say, even things that seem like they're not linked, like diabetes, has a connection. I read a very interesting paper as well. Like the immune system is very greedy. It's very expensive. It takes a lot of glucose. So, you know, this is another reason why all of your kind of glucose levels and things become out of balance when your immune system is on all the time. So, you
Correct,
know,
correct.
there's little connections here that people don't quite make the connection. If you get your mitochondria going, if you give the body the energy it needs, if you kind of give the immune system the energy so it doesn't have to steal the glucose, you know, you kind of avoid a lot of these problems. So,
Like you also you avoid a lot of these chronic inflammatory at the cellular level. So like ultimately cancer and leaky guts, ultimately at the cellular level, it is inflammation which is chronically getting, like one of the key things I talk about is cellular dehydration. Like ultimately we at a cellular level, we are chronically getting dehydrated, and like again the detox pathways of our cells, we are not letting it perform at its optimum peak, and then because of chronic metabolites getting stored back, they cause diseases, like same with Alzheimer's and same with other neurodegenerative diseases. So thinking of that way, I had one question in front of me: can photobiomodulation reverse Alzheimer's, memory loss, or brain damage? That's a obviously a very open and a wild question, but obviously, so we should definitely be careful when we use the word reverse. This is definitely emerging research exploring photobiomodulation in cognitive and neurodegenerative context, but it's definitely not a cure. Like it can definitely help, again back going to the basics. It'll help through the neurodegenerative pathway. It'll help support sleep quality. It'll help improve brain energy signaling, and it will also help the may help activate the glymphatic pathway, bringing the brain neural inflammation load down, which are obviously the foundation basis. And then if you do this consistently, good sleep quality, good energy levels, lower inflammation, then obviously cognitive clarity, and like it may improve symptoms and signs of memory loss or brain damage. So like obvious, that's quite obvious. And then it'll be good to like club this with activities of flow state. Like if, like for
yes.
example, if I'll be very happy and curious to if like activating the gut brain connection could in, and like with the right audio, we can entice the flow state in people. That'll be
Yeah.
really good if we can do it. I don't think any device is yet claims that they can activate flow state like neurobiologically.
Yes, for sure. And even synaptogenesis and neurogenesis. But we're going to get into flow states because I want to talk to you about the pulsing. Tanya, you're on the camera. Did you have a question? Have you got a question
Yes,
for
please.
us?
Yes, hi. Thanks for hosting this. I suffer from migraines,
Yes,
and
yes.
I've had some success
Mhm.
with red light. I don't know what I'm doing though. I only started 2 months ago, and the first time I used it, I was shocked. I managed to stop a migraine on the same day. And I've had them for years, and this is the first time, except for using a vagal nerve stimulators, which are also
Yes.
helping. But red light, it managed. I used the flex beam. I had it on just the red light, not even the infrared. And I had it on for 10 minutes on my ankle, and it literally stopped a really bad one from starting. So I'm fascinated now, and I'm hooked, and I need to figure out because I don't take medication for migraines. And I think this is the
So,
way
so like,
forward.
I'd love to answer that question because during my childhood, I was also suffering from migraine,
Oh,
and
I'm sorry. Okay, so you know.
but like ideally, you definitely say that once migraine patient, like always a migraine patient in my life, but like it's been over like I think 15-20 years. So I basically cured my migraine. That was mainly the mindset approach, but I totally and like so you have used red light for migraine, but have you used CeraThrive or you have used other things?
No, not CeraThrive. No.
Like I think because you rightly said migraine. What is migraine? Migraine is basically migraine is sensitive to overstimulation, and it is basically so when if you use photobiomodulation, the red light, it's like a supportive tool, and like I will start to use slow doses and less triggers, but ultimately consistency is what happens. And we were discussing that it helps ultimately with sleep consistency, and it helps with better quality sleep. So, and like it brings the overall neural inflammatory tone down. So I think you should definitely try the gut brain, the CeraThrive, because it works on even the vagal nerve, and I love all kinds of vagal nerve calming activities. Sarah knows about it. I've been teaching people about underwater meditation as how to calm your vagal nerve down, and that's what the blue mind and the red mind philosophy is actually. So like photobiomodulation is a great tool for migraine, but obviously not so like since we are giving this as an advice, so we have to be careful that it has to be uh, I will recommend anybody with migraine to start low with and track any triggers, like probably any sessions or any maybe gamma waves can trigger, and then you can do an alpha wave session along with the red light, and like maybe use it earlier in the day and not before you go to bed, and then
Yes,
focus on
yes.
like consistency and hydration, electrolytes. See, it's always you have to be. It's always a 360 approach. That's why I love longevity about, because at least in longevity people are talking the basis is 360. You cannot focus, and that's why the current overall disease centric approach fails, because that's very narrow approach, and true health is a 360 approach.
Yeah, for sure. And migraine, we also know, sometimes it's can be contraction of blood vessels, and we know that when you release nitric oxide, like you do with light therapy, you actually have this dilation of the blood vessels. So that could be another way it's working. That's why it may be good to actually have it on the head, and like as Arpit says, have it on the site of the vagus nerve, because then you're kind of giving your body the best chance to one kind of activate that inflammatory response, but also to open the blood vessels, because I think one of the theories is sometimes for whatever reason blood vessels
Mm.
constrict, and that's one of
Where
the
I was where I was totally shocked was I with the migraines I get, they've changed a little. So I suffer from terrible nausea now. That's
yeah.
always my prodrome. And I put the flex beam on my gut, and that was what stopped it. So I was trying to figure out
So like now
what was that? What was that mechanism? Yeah,
so as you rightly said, nausea and migraine are directly connected. That's the again the gut brain
the
axis
gut brain, yes, yeah.
action. So then if you even modulate the red light with your brain and the gut, it'll definitely help your symptoms even better. I strongly feel that
Hmm.
like that'll be much better version for you. Like, and obviously you have to go slow, but it's a great tool. And but in terms of the vessel constriction, like migraine is, people say sometimes that it's because of vasodilatation. So it's like a mixed theory. So it's that phase, it may or may not help, but yeah, definitely.
Okay,
Excellent.
looking
Thank
forward
you.
to it. Yes, thank
Thank you,
you.
Tanya. Thank you. We have another question. We have Linda. I'm going to get to you, Linda. Just before that, we have someone who's asked, what's the difference between alpha and gamma? So, this is referring to the brain waves. So we touched on this lightly, but
But
the CeraThrive.
I will explain it. I would love to explain. It's my favorite question.
Oh, good. Go for it, Arpit.
So like alpha, see, we need to understand that we are all frequency beings. We are all light beings. We are emitting like, and now with the knowledge of heart brain connection and with the knowledge of so many electromyographs of your body, your energy, your aura readings, you can understand that we have a frequency which we emit. And most common places in the human body which emit strong frequencies is, one is the heart and one is the brain. So you have that is why the heart math institute works on the heart math connection. And it has been measured that when you measure your energy, you have a field of your electromagnetic field, and like your heart brain electromagnetic field, it goes much beyond than your physical body. It has been proved, so there is no woo woo science about this anymore.
No, no.
And then there are the brain waves. And so when we are active, when we are hyper, right, like right now I'm explaining a question, so my brain is in beta. Beta is usually 12 to 20 hertz. And then when you go to sleep, so you enter that magic alpha state. Alpha state is that 8 hertz number. And then so your brain wave starts to get slow down, and then you cross theta delta. So these are very, very slow deep sleep. So and the so that was the, and like you must recall, and like gamma are waves like which are in extreme concentration, or those insight moments, or those when it can go up to 40 waves, it can go, super gamma can up to go even 100 waves. And like in your REM sleep, sometimes you go to gamma. And when you're getting dreams, specifically high people who are lucid dreaming, who are able to control their dreams, they get high, more gamma waves. So gamma is basically your brain vibrating at a very high frequency, but it's like more when you're dreaming, more when you're doing very, very creative tasks, more when you're doing getting insights or some brilliant piece of cognitive information, that is gamma. But I would, since whosoever asked this question, I'm sure I would go a little bit to explain the magic of alpha. You may have heard about alpha Silva method, manifestation methods, where people, Silva method is one of the biggest manifestation techniques, which people talk you with various kinds of meditation and the binaural beats to get into that alpha state.
Well,
And
the
like
headband is the headband pulses alpha, and then the
yes.
sound file does alpha in the background on the CeraThrive headband.
Exactly. So like alpha is 8 hertz, and now again the nature connection. The earth also vibrates at the Schumann resonance, that is
7.8.
7.83 hertz. So
Mm-hmm.
again close to 8 hertz, and that is again the where all the magic manifestation people also say go to your alpha wave. So that is why
Yeah.
again we are coming to the blue mind, red mind living, that when you, so are we naturally cross that alpha state when we go to sleep and when we wake up. So that time we have to be slow with our activities. Don't bombard yourself with blue screens. Don't bombard yourself with WhatsApp messages. Don't bombard yourself with alarm clocks, because
Mm.
that's slow out of the blue. If you are sleeping in theta or delta and your alarm clock rings or somebody bangs at your door, then your brain goes in beta, and that's not healthy for your brain.
Yeah, for sure. So that's why we try to, in the CeraThrive device, we have those programs, we have Schumann, so that you can also, while you're kind of doing all these lifestyle things, you can wear the device and it actually helps your brain in train, because light is this, light and sound, they have a similar effect on the brain. If you pulse the light at 7.8 or 10 we have 40, we have 100. You can actually help the brain to kind of remember or entrain to those brainwave frequencies
Alpha
also.
entrainment, that is audiovisual entrainment these days. Even like so red light is one of the variants. Even neurovisor is another variant where you can audio visually entrain. And like brain alpha entrainment is the one of the best ways to like also help people get into the flow state, which we were
Yes,
talking
for
again.
sure. Yeah,
Hmm.
so if people want to know which of the CeraThrive programs to use, they're called, the names are there to help you. The meditation one is the 100 hertz. It's funny you
Yeah.
say that about altered states because that's where that one came from the consciousness department at Arizona. They were using 100 hertz frequency. So we have that one in the CeraThrive device, and people find that it helps you get into deeper meditation. So we call that one meditation.
So like I start my day with balance, and
Right.
sometimes when I end my day with balance, and during the day when like between like last since I'm also joining as the chief medical officer, I was more curious on experimenting on myself like more,
Yes.
so that I have like more insight. So like now I've been almost doing like up to 3 times a day, and like I'm tracking my numbers on Whoop, on Aura, and like it's mind boggling. And specifically going to bed, it's and then also there are resilience, the resilience one is also
Yes.
brilliant. So it's a good the modes will definitely guide you, but if anybody still needs any specific instruction, then we will be happy to help them.
Yes, and we'll be making videos to help people understand better. We have little videos in the app, of course, but help people understand, okay, this is flow state. If you want to get into the flow state, you might also want to pulse with this certain frequency. Or, if people are very highly strung, they might want to calm down. So there's different ways that you can use the pulsing. So hopefully we answered that question. But of course, as Arpit said, we can go into this in a lot more detail. We've got a couple of questions outstanding, Arpit. We have a
Linda
lady
was
who
there, huh? You wanted to take Linda's question. Linda Jo?
Yes, and it was a very long question, and I think
Yeah.
you've probably got it printed out about her son with a condition.
Yeah.
Um,
So her child is suffering from plexiform schwannoma, spinal tumors, and like would she basically she's trying to ask, can photobiomodulation help to
yes,
reduce tumors and regenerate nerves? So see,
yes,
that's very early, but like first of all, I'm very sorry for your family is going through
yes,
this, Linda, and I can't give like treatment advice directly to eliminate the tumor remotely, and I should not be ideally doing this. So I'm not just giving you advice, I'm just trying to give you knowledge so that then you can take your own responsible call. So for pediatric schwannomas and like I don't know whether the surgery has been done or not done, like you need specialized team with a lot of neurosurgery and like you are, I'm sure you are doing all the things, but you still are curious to get to like additional moments of healing. So what I can say generally that nerve recovery like focuses on obviously like red light therapy. I would say it can again help bring down the basics, bring down the nervous system down, the nervous tone down, the overall modulatory, neuromodulatory inflammation markers. It can help down, but it cannot promise any regenerative nerve options. But I would like be definitely open to trying because it can definitely not harm for sure. And but obviously try it in a gradual way and then see the benefits. And like like would it'll be better to guide you more specific instead of a, because it's a very specific question. So it's if possible we can help her get a consultation.
yes, for sure. I think that's the best way. Yes, thank you, Linda, for that question. Somebody else is asking, they have V-Light, which is a different device. Do they still need a CeraThrive? There are lots of these brain devices on the market, and they all have different specialties. V-Light is an excellent company. You may want to try something where you're tackling the gut at the same time. Is all I'll say to that. V-Light is a brilliant company. So if you're getting results with that one, carry on with that one. It might also be good to do something where you're doing gut brain.
Yeah, so
Um,
like that's what like I believe like definitely, but like I think simultaneous photo biomodulation is going to be a game changer. So like we need to prove it more dynamically so people will have definitely more goals too. But I'm definitely sure because it's a no-brainer, and to activate the vagal
the
nerve.
gut at the same time.
Yeah,
Yeah.
yeah.
I think so too. This is an interesting one, Arpit, that I've kind of got into lately. Um, can you impact your oral flora with gut PBM? because there's a lot of stuff actually at the moment about
So aura, your energy field, no,
oral, like
oral flora. Okay, oral flora.
yeah, there's a lot of stuff now about how the bacteria in your mouth actually ends up in your gut. So I would say watch this space because actually CeraThrive, we're kind of interested in the oral microbiome, but I think really what you need to do is heal the gut. Then the gut can deal with any kind of assaults. Obviously, you need to take care of your oral microbiome because you actually make a lot of nitric oxide there in your mouth, which is very important. But healing the gut probably has priority. If you heal the gut can handle it. If you've got a very disturbed gut, it's going to struggle with anything.
Ultimately in life, and like with red light and with all kinds of disease, the we have to work on resilience. That is why I love this marker of heart rate variability, and it has to be,
Yes.
your gut has to be more resilient, your brain has to be more resilient, your immune system has to be more resilient. And so as beautifully said by Sarah, that we need to make our gut more diverse and more resilient, and then oral microbiome is just a sub extension of your gut microbiome ideally. But
Yeah.
still, like off the record, like if still somebody is really suffering from our oral microbiome, then I recently discovered a very, very interesting product in Dubai that was HOCl, like low dose hypochloric acid. And that was is really seeming to be a quite a game changer. Like two of three of my very close people were suffering from a lot of dental issues, and like it. So I can connect again. If anybody is interested, they can connect. I can connect separately.
For sure. It's a very interesting one, the oral microbiome. It's something I've been researching. And like I say, I have a product kind of in the works about that because I think it's
Sure, like I'm
important.
like sure, like it should definitely work again. The basics are the same, right? If we, but
Yes,
like for
it's all a
that,
connected system.
can we make a device where like we can give some oral microbiome red light directly on location site wise? Then it'll have more sense to work on it.
Yes, then it makes more sense for sure. Okay, can CeraThrive help with sluggish malabsorption? Says a Zoom user.
Okay. I'm
Sluggish
sure
malabsorption.
this is what is sluggish malformation is malabsorption. Sorry, is basically leaky gut, and
Yeah,
like a version of that, or a inflamed gut. If I may not point it to a leaky gut. And again, with your gut being more through photobiomodulation, you can make your gut more resilient and make it more calmer the inflammation at the root cellular levels. And then definitely over a consistent period, again, not it can be one of the contributors factor. It can definitely not do its wonders solely. We are not claiming that that's a magic thing, but definitely it's an assistant. As an assistant, I'm sure you are doing your nutrition right. There is so many hydration right. You have to again
yeah,
work on parallelly on so many things, and then definitely I would say it can help.
yeah, for sure. Yeah, all of these things are so intrinsically linked. Once you start like healing those tight junctions, once the gut starts working, the mitochondria power up, all of these things start to fit into place, I think. And yeah, of course, malabsorption is an issue because it's almost like a sieve, isn't it? If your gut is leaky, all of the good food you're putting in, all the probiotics are just kind of, you might as well just tip it down a sieve. You really do need to heal the gut first, and then you can kind of deal with all these other things.
There's one
Uh,
question which I want to like take. I was just going through the questions like, how do I know that if I'm using it too much or too little? That's a
now
very common question, like,
that's
and a very basic question, but like I would love to help people who are still stuck here, because again, your body gives you the feedback, and like, so you need to listen to your body, and that's the basis of any longevity biohacking is awareness, and your body will always give you signals and signs. So like signs of overuse, we have already said, like headache, agitation, sleep kind of disturbances. And if that happens, then obviously reduce, and like instead of taking hard calls, because you may feel that it is still benefiting, and then you still one day you get a headache, you would not want to stop it altogether. So you bring it down. And like improvement, obviously it's not like thing one magic thing you will do one day and you will get the best sleep of your life. So you will like better sleep again with consistency, you will get to in that. And your calmer stress response, your resilience, that's the thing which we are working on. Anything, not just CeraThrive or red light, anything
yeah,
works with consistency. And once you train your HRV, you become more calmer, and then you slowly see differences in your life in terms
Yeah.
of your own nervous system reaction, like with your family, with your patients, with your
Mm.
client, you become more calmer in general. And so one thing which I personally have been trying to do is like observe yourself. With all this biohacking and longevity, I have added the quantum observer since you introduced me to the quantum world through that book. Of course, I was also deep diving into it anyways, but practice the quantum observer effect continuously throughout the day. Like for example, when I'm doing a run, or when like I in moments in between, I observe myself doing that run. So I'm outside my body, just observing myself doing the run. When I'm doing a surgery, I am also observing myself doing the surgery. Right now, while doing this webinar, I'm observing myself giving that seminar. So just that perspective, it changes your nervous system frequency. Like many people are still stuck in the wrong survival stress frequency, and that changes the game, I think.
Yes. And I think that leads on to another question that we had here was how many times can I use the CeraThrive device in a day? I think it leads on from that, Arpit. You need to kind of know where you are individually because it is a little bit individual. If you do a session and you're totally fine, you can do another session. If you find you're a little bit tired afterwards, maybe you've had enough. And I think generally, the sicker you are, the less you need to do. It's a little bit counterintuitive, but the sicker you are,
Because
yeah, because your mitochondria, if they're not functioning very well, you don't need much light to get them going. If your mitochondria are good, you can tolerate a lot of light. So I
yeah,
think as
that's
a rule
that's
of,
a good answer. Yeah. So
yeah, as
probably
a
like
rule of thumb,
I
yeah.
giving you my personal example, like I have been experiencing this device over a year now, but now like since I was joining as a CMO, I wanted to explore more. So like I'm loving it. Like I can do it like 2 sessions in the morning, 2 sessions before going to bed, and at least 1 session during the day. Like obviously there are different modes, so you can play around with it.
Yeah,
By God's grace, I don't have a disease. I'm just trying to help
yes.
document some protocols which can help you achieve, like later we can introduce some models where we can help people get into flow state through light, as we were
Yes.
discussing.
But you're super healthy, Arpit. So I think if you were to apply it to a patient that was really quite sick, they
Yeah.
may even need to do half a session even. So I think it's just about, kind of knowing where you're at. As a rule of thumb, the kind of sicker you are, or the more your mitochondria are depleted, the less light you need. If your mitochondria are quite happy and buzzing along, you can, like Arpit, do it like 3 or 4 times in a day. I,
Tanya,
I, I often do it twice a day. Yeah.
Tanya is asking another simple question, that is there an actual lab test to measure mitochondrial function? So Tanya, you
Ah,
can connect to me on Instagram. I can like there are some cellular level testings done which can help you understand your mitochondrial age, your biological age. And like I work with a few companies based in Germany only. So she's based in Berlin, she said. So you
right.
can please connect to me individually, because this is directly related to this. But yeah,
Okay, we're
good.
coming to the end, Arpit,
Yeah,
because I know we've
yeah.
got one more. We've got a comment here that red light therapy has helped my daughter with constipation, which kind of fitted into what we were talking about gut function. So that's great. Thank you for that, Tanya. But yes, I think then just to wrap up from you and I, Arpit, we're just about to embark then on doing exactly as you said. We'll be writing some protocols. We're going to be doing
There is one more question. There's somebody asked this open-ended question. What's one thing people should remember from today? So I would
ah,
say,
that's a lovely question.
yeah, photobiomodulation, I would say, it supports regulation and recovery. It doesn't replace any diagnosis. It doesn't, or a cure for anything. The big results come from when we pair it with obviously the 360 approach, the sleep timing, the hydration, the movement, metabolic stability, and so many other things. But like it can definitely, I am personally called as the Aquaman biohacker, and I've been doing and personally so many things, but CeraThrive is one of my genuinely one of the best favorite ones.
Thank you, Arpit. And from my point of view, I think the take home is yes, exactly right. This is an excellent tool. We need to understand how the body and the brain are connected and treat the body as a system. We're kind of what we're offering here is something where you can treat the body systemically. And as you said, Arpit, over time and with consistency, people can really genuinely get relief from a lot of things and help them drop into this kind of blue mind state a bit more often. And that's where genuine healing comes from. So I think if people want to take anything, really, we have the tools available to us. They're non-toxic and non-invasive. So, why don't we take advantage of them? So,
And like it's super handy. So if you have own one, then Sarah only gave me this brilliant idea. Ever since I saw you using one on your travels, like I definitely it's my best travel companion, and I usually do it on my flight, especially if it's a long flight. Because again,
yes.
travel brings you a lot of stress, mitochondrial stress, cellular stress, sleep, circadian biology, different stress, and then you that those are the times where you need to activate the light to help that regulation bring back to down and more be in the blue mind.
Yes, for sure. We've got the technology. We just need to implement it and kind of feel empowered to do so. Thank you so much, Arpit. I'm going to leave. We're going to be offering, I know for some people, there's still a bit of hesitancy because it is new technology. So what we're offering people who attend this webinar is that we're extending our kind of trial period. So people can try this device totally risk-free for 60 days. We usually offer 30 days. So we're doubling that. So it gives people a good chance to really try for themselves and see how it works for them, because we're pretty confident that after that extended period people start to really experience the benefits. So we're going to be sending out an email. You're going to be seeing a lot of Dr. Arpit Bansal with CeraThrive. We're really looking forward to that. So I'll just wrap up by saying thank you so much, Arpit, for your time today. It's always such a pleasure.
Yes. Looking forward to meet you soon
Thank you. And
somewhere.
thank you to all our lovely participants. Like I say, we'll be sending out an email, and Arpit and I are very accessible. So if you have any questions or anything, we're on all the socials. And of course, I'm Sarah at CeraThrive.com, so people can reach me directly. So thanks again, Arpit.
My Instagram is @ Dr. Arpit Bansal. That's easy, like just my name.
Just your name,
Dr.
Arpit.
Yeah.
Okay, thank you, Arpit. And we'll be seeing more of you soon. And thank you to everyone. Take care. Have a lovely evening.
Thank you. Bye bye.